Hi everybody, this is Rhys Barber from Audiology Associates. Thank you very much for watching our earwax removal video today. Oh, lovely lady came through to clinic today with very blocked up ears on both sides. This lady normally has her ears cleaned out about every 6 months, but it's been a good almost 2 years since the last time she had these cleaned out. So what we've got in here is a very sticky, stretchy type of earwax, very thick, sort of almost like a toffee consistency coming away here. It's very light in color, so there's this almost golden color as well, which usually indicates it's going to be this more sticky type of wax. What you'll see here is rather than doing a normal wiggle, I'm using a kind of figure-of-8 technique here, which just helps to guide the wax down and keep it away from the canal walls. So when you're wiggling back and forth, when you've got very sticky wax like this is, it'll stick to opposing canal walls. You can see it stretching out of the canal there, almost like a little skin ribbon, because there are these very kind of fine keratin layers in here as well, which are drawing out almost like these very sort of thin skin ribbons. Yeah, go back to what we were talking about, wiggling back and forth. You can stick it to opposing canal walls. If we do the figure-of-8, it kind of takes it close to the canal wall, but does keep it moving, so it's less likely to stick. But you can see as we draw this out, look how this stretches out the canal. You can see it kind of pulls, almost like a soft candle wax. It kind of pulls into a pointed shape as you're drawing it away. Quite narrow little ear canals, these at the entrance, and lots of this kind of very thin keratin material, very sticky wax material. It's more likely to get this kind of sticky nature to it if you've got a lot of keratin in there as well, because it dries it out a little bit, which makes it very tacky and sticky. If you actually put your fingers on this, it would stick to your fingers as well. It was when you got the gloves on, you're trying to get it off. It's very sticky. So you can see we're drawing the canal wall sides, all the wax from those canal wall sides first of all, before we can get to the second section, which is a little bit further in. But lots and lots of drawing these long ribbons out here, and all that's around the outside edge, this very thin layer. You can see that keratinous layer there coming away. Then you've got this plug of sticky wax is sitting behind this. So we've got to deal with this first before we can draw that next section down. So you can see as I'm drawing it away, a lot of the time we miss the kind of slow motion part of it, only because as I'm drawing this away, it's coming so far out of the patient's ear that I'm trying to break it away. And as I'm trying to move to the next slot, it's sucking those bits in. So that's why I'm not really able to show you so much of the slow-mo stuff that we normally do on this one. But you can see now I'm lifting from the side of the canal wall. We could introduce a little bit of olive oil into this ear canal if we wanted to, and I do that for the second ear. But for this first one, because it is all moving out quite well, without sticking too much, it's coming away quite nicely. Rather than run the risk of sort of blurring the endoscope with the olive oil in there, I'd rather just carry on as we are for the time being. There we are, you can see it, you can see the plug now just that little bit further in. So you can, as I'm trying to lift this, as soon as we get to see the canal wall, which is what we're going to see in a second here, as soon as you can see that canal wall, you know you can get that next plug away. So what you're looking for is the base of the canal. So underneath the suction tube there, what you can see what I'm doing is trying to get all this sticky stuff off the entrance, because if I try and pull that central plug forwards like this, it's just going to bind to that sticky keratinous layer, and then we're going to end up with everything all bunched in. But there, did you see that come where you can just see the skin of the ear canal wall there now? Which means that when we draw this down, it's less likely to stick there. So we've got a little section to the right side, which we're going to need to deal with first of all. There we are. And then we're going to aim for that bottom section just above where we just removed the wax from the outside edge, because we're going to try and spin it. We're going to try and bring that bottom section around so we can draw this down. There we are. You can see it starting to turn. There we go. We've got a good grip with it there. Unfortunately, it's not going to get out of this entrance to the canal. It's just too narrow. So Jobson horn's going to come in. It's great for this type of wax. We're going to go over the top of this now and draw this plug out. Now we've wedged the plug at the entrance to the canal, so it's not going to go anywhere, because sometimes you run the risk of, as you put the Jobson horn in, it rolling back into place. So we wedge it there first of all. There we go. That's come away nicely. You can see it kind of changing shape and kind of morphing as we bring this out into the shape of the entrance to the canal there. This last little bit here just stuck to the left-hand side of the canal wall here, just at the entrance. So we'll get rid of that. There's a little bit there stuck to the right-hand side as well. There we are. You can see that last little bit here. Let's lift this off the canal wall. There we go. Look, we're just kind of wiggling this back and forth now, rocking this down the canal, stopping it from sticking out its way down. So this is the back section. There we go. Lovely. That's come away really, really nicely. You can see that golden color to that wax as well there. Just clear the remnants. You can see we're having to constantly clear the remnants from this left side. So there we are. And there's a little tiny bit to the right. Let's just get rid of that. I can see the eardrum already, that grayer, sort of almost light grey blue behind there. There we go, that's coming away nice. My hands are up here all the time. So we're just drawing this away. I'm really conscious, I don't want to move my hands too much out here, so I'm trying, because people find it a bit distracted, so I'm trying my best to hold it in place. So we're just drawing this last little piece down now. There we go. And when we took a look behind that, you can actually see the little dry skin layers there at the top of the canal wall, but the eardrum itself lacking a light reflex there, very grey blue. Patient was an elderly patient. This lady was in her 80s, so you do expect a little bit of greying to the eardrum there as well as we get a bit older. So this is the same patient now, but obviously the second ear, so this is the left-hand side now. And we've got very, very sticky wax in here, and it's almost hardened on the outside edge, so almost like a very I don't want to say crusty, that would be the wrong way of describing it, like a almost like a hard shell around this wax, this one at the entrance here, which means the suction's not really going to get through this. So we've switched to the Jobson horn now just to try and tease this away. And this lady was so lovely as well. She sat through all of this, didn't budge once. She was lovely. We were having a bit of a laugh and a joke as we were going through this. But yeah, absolute diamond, lovely lady. So we're just taking this this sort of next section where you can see we broke through that first section. Now sometimes that's enough for us to be able to fold the sides in and get a good grip on this sticky layer on the outside edge. But this is just tough as old boots. It's not going to shift here very easily. I've introduced a little bit of olive oil because that can help, as we said earlier, to stop it from sticking again. And sometimes it helps us to get a good grip that we'll draw this section down. There we are. We've got to that top part of the wax there. I'm trying to see if I can roll this. It kind of depends on how long this plug is, how far back it goes. So if it's going quite a way down, you're not going to be able to roll it. Or if it's very stuck all the way along, you're not going to be able to roll it, which is exactly what's happening here. The way you'll be able to tell that is when you get a grip. If you can roll it, you'll see the whole thing tip forwards. Otherwise, what you'll see is the top almost stretching down. Imagine you've got a piece of Play-Doh. I'm sure you have Play-Doh in the US as well. But if you imagine kind of trying to pull that down, sort of unstick it from the tub of Play-Doh, then it just kind of pulls down from the top rather than rolls forwards. You know it's still stuck in there. Yeah, that's a really good, because that's a good analogy actually for this type of earwax. If you've got kids and they've got Play-Doh, stick it to the inside of the tub and then try and get it out. That's what your kind of consistency you're looking for here. So you can see then it's just starting to kind of pull forward. We're getting a little bit of momentum. We're getting some movement here with the Jobson horn. What I can see here though is this wax goes very deep, which means we can only use the Jobson horn up to a certain point. Past that point, it becomes a little bit dangerous to use the Jobson horn because you're working blind, which is exactly where we are now. So I can see we've got this kind of smooth layer, which is about 3/4 of the way down the ear canal here. Now, the last thing you want to do with the Jobson horn is push through that layer and hit the eardrum behind, then draw down. So we're going to use the suction tube here just to try and get rid of all the sticky bits around the bottom part of the canal where we've used the Jobson horn and pressed it down against that. So we're going to remove those first, which is what you can see stretching away there. Long pieces coming away. And then we'll get to the section behind this now. There we are, just lift this up. Wiggling again. Back and forth, trying to loosen this off the canal. You can see just how tough and sticky this section is. We have a dessert here in the UK. It's called treacle tart. And the inside, I apologize in advance if everyone loves treacle tart and I'm going to put them off this, but it's that kind of consistency to the center of that dessert is kind of the sensation you get here. So just taking this away. I've lost track of how many foodstuffs I've made analogies to this wax to. I really apologize if I put anyone off their food. I think we did toffee and treacle tart. Play-Doh's okay, I suppose. So it's still coming away there really nicely. It's taking a little bit of time. You've just got to be patient with this type of wax. There's no point in rushing it. We've introduced a little bit more olive oil in here as well to give us a bit of a helping hand, just to stop this from sticking again. You can see the process of what we're trying to do here is lift this. There we go. As we lift, you can see the bottom spin. It just turns slightly, which means we've loosened this big plug here. It would have been very difficult if this was stuck to the eardrum. It would have been a really a difficult extraction to do. Luckily, it's not. So we've managed to draw this forwards now. I need to try and, as we did with the other ear, we need to try and wedge this now into the ear canal entrance to be able to get the Jobson horn behind it. Because I don't think the suction tube is going to hold onto it well enough here to get this out. And it looks pretty firmly stuck just there. Let's bring in, I thought we were bringing it, sorry, I thought we were bringing the Jobson horn. We've gone back in with the suction tube. Oh, I can see, we're trying to roll this forwards. Okay, so there we go. So we're just kind of rolling this forwards. Oh, I've got a bit of a wiggle going here, but it's just jammed at that entrance. This is where the Jobson horn comes in. So we're going to pop this over the top. There we go. Just sneak behind it, bring it forward a little bit further in. There we go. We've got behind that plug now. Out this comes. There we go. So that's that plug come away there. Patient instantly hearing better. So much better. There we go. Eardrum. Like I said, looking a little bit grey. Hammer bone pointing up to the left. What would normally be the light reflex, you can see a little dot there. Was to the left hand side. Oh, look at what we removed. So this was, oh my goodness, 2 3/4 inches, I'm going to call that, 7 centimeters. That was a lot of wax to have built up in that poor lady's ear. Patient hearing so much better. Very relieved to get that out, as you can well imagine. Well guys, if you did enjoy that video, give us a thumbs up. If you really enjoyed it, then please consider subscribing. I shall see you again for the next video. As always guys, take care of yourselves, take care of one another, and I'll see you soon.